Hi everyone, Jason Chapin from the WCA. Just want to tell you about our recent Regional Workforce Development Summit and some of our speakers and what they had to share. We were pleased to have Westchester County Executive George Latimer give welcome remarks.
We're tasked not with solving the problem, but with being your partner at WCA. We figure out how do we take what resources we have in government, and we have some traditional resources. The industrial development incentive programs exist. We have money that we set aside for infrastructure, for certain kinds of things that will help us in terms of this. We have the responsibility to, you've all finished breakfast yet? We have the responsibility to treat sewerage, and that becomes an important part in development and growth. But in all of these different areas, it's not government working outside on its own agenda. It's government working in a partnership with organizations like this and others.
We had Jason Bram from the Federal Reserve Bank, and he gave a great regional job outlook and covered all of the challenges and opportunities.
Basically, unemployment's near record lows. New York City remains the engine of job growth. There are many signs that the economy is slowing: housing markets, job growth, business surveys. But despite these tight job markets, wage growth remains pretty subdued.
We were very fortunate to have Melinda Mack, the Executive Director of the New York State Association of Training and Employment Providers, attend the conference. She did a great job moderating.
So I heard Dr. Miles talked about credential creep, which is when you're asking for a higher level of skill than is necessary to do the job. When I worked in New York City, we did a really large recruitment for Whole Foods, and they were asking for associate's degrees for cashiers, right? And so I was, again, really thinking about those job descriptions. I heard Joe talk a little bit about how you invest as a company and your longer-term outlook around workforce development and skill upgrading. And then I heard from Diane this concept of being creative and how you actually think differently about some of those investments, as well as the internal pipeline. Two sort of other things I wanted to mention is there's a nationally recognized program called the Employer Resource Network, or the EARN. It started actually in Ohio and Michigan and is now sort of spreading across upstate New York, where it's a service that employers pay into for a network of community-based organizations to support low-wage workers with childcare, housing, legal support, any other sort of benefit that they may need that helps them stay employed. The other, which is really interesting, is we talked to upstate manufacturers, including companies like Optimax. They're thinking more creatively about how they think about time and leave for their employees. So Optimax might be going to unlimited leave as a benefit. Another is thinking about shifting start times. Childcare is one of your primary challenges, and you're asking everyone to be there at 9 a.m. How do you shift the start time so that people can get their kids to school, right? So just basic things that I think people are investing in.
And we also had Diane Woolley from White Plains Hospital talking about her Earn While You Learn program.
So I'll take an example of an OR scrub tech, which is a very hard job to fill. We were just spinning our wheels recruiting. Finally, we just said, why don't we look at some of our internal talent, see if we can get them interested in the training, and what are the barriers to them doing that so that they would move on to these jobs. Some of the barriers were they didn't have the resources to go to school, they didn't have the time to go to school. So what Earn While You Learn is actually a program that takes that full-time worker. We partner with a school, and what we do is look at the school program, pay the employee to go to school, so their complement of hours, so let's take, for example, if it's a 40-hour employee and there's a 15-hour requirement to be in school, they work the other 25 hours in their existing job. Once we get them through the program, then they are committed to staying with us for a period of time in that new role. What this has done is it's allowed some advancement, it's allowed some people to go back to school that otherwise couldn't go back to school, and then it's opened up the doors for some of those entry-level jobs, which is where we were able to work with the Jobs Waiting Program and hire some talent to move into those jobs. That program was so successful that we've actually just started the second round for OR Scrub Techs this month, and we're moving on to respiratory therapists as well.
We had Joe Carbone from The Workplace, and he talked about their nationally recognized platform to employment and how that helps employers and job seekers.
We're doing it now with older workers, and we just started to do it with the reentry population. We actually did it with the foreign-born as well, and it's got an 80% plus private sector job placement rate anywhere in the country where it's been used. And it's basically to hold employers free of all risk, so that it's to give somebody a chance. I mean, in some cases, you can understand why there might be a little bit of reluctance on the part of an employer, but when you take risk off the table, if that's what's necessary to give somebody a chance, then I think you do it. So that program has yielded results for us that have just been phenomenal. In Connecticut, as an example, right now, where we're doing it statewide, the average wage is more than $51,000 a year. And I'm able to say to our legislators, in 1 year and 5 months of employment, they're going to pay back the state and state income tax what it costs Connecticut to move them from long-term unemployment, and they're all folks over 50, into employment. So applying the same principal program to the reentry population, and we got a statewide contract on that as well, and to other groups, that's the way to go, Tom.
And we also had Dr. Belinda Miles from Westchester Community College, and the college provides a number of different programs for their students as well as employers.
A couple of months ago, we went kind of old school, and we had the opportunity to provide a bus tour, which engaged some of the high school counselors in going out to industry so that they could better understand some of the industry sectors and clusters, because they didn't understand what we mean by advanced manufacturing or some of the high-tech careers within the health career organization. I'm looking at Con Ed here and very grateful for the opportunity that we had to work with Laura and Jane and others, our own Lori Miller-McNeil from the college, on coordinating these individuals who had an opportunity to go out and see what it's like. Con Ed was one of the stops along the way. And the comprehensive materials that the organizations provided that showed here's what kinds of credentials you need, here's what the pathway is, here's where you can start, and here's where you can go after a couple of years. Folks don't know that. We serve so many first-generation students at the college that they're not having these conversations around the dinner table, and they may not be exposed to people who have careers, or that's not what they're talking about when they gather at Thanksgiving. You know, hey, Uncle Joe, how did you do in that career? What is it that you're doing to earn a living? And you could be that close and not really know what's going on. So that kind of exposure is key. And having the instructional support in the classroom include problem-based learning, real-world problems that are taking place that make the theory applicable to something that is relevant to the student, is something that engages them and also prepares them and gives them a more realistic idea about what lies ahead.
If you want to learn more, you can see a recording of the event, and all you have to do is visit the Westchester County Association Facebook page and LinkedIn page.